Internal bipolar is where everything is happening on the inside in terms of all of the mania and the speed up to the nervous system is internal rather than the external impulsive behaviors that we might see with other types of bipolar. The individual who experiences internal bipolar is most likely to have a diagnosis of bipolar II, and this would be a subtype of bipolar II. It might take someone with internal bipolar, again, just a term that I'm using, a long time to get an accurate diagnosis, because with typical bipolar, we're seeing the impulsive behaviors, the spending sprees, the compulsive sex, the irrational outward behavior. And with internal bipolar, what we are seeing, if we observe someone who has this, is a more introspective person, maybe a more introverted person who's just never going to do irrational behaviors. What they're experiencing on the inside is irritability, restlessness, racing thoughts, overwhelm, possibly in many cases is going to be brought on by lack of sleep. So there's a huge significance with all types of bipolar. Sleep has a really crucial part to play. And certainly with this type of internal bipolar, usually the onset is going to be depression, lack of sleep, or bottled up emotions that haven't been dealt with. So in all of the individuals that I've ever encountered with this condition, there is trauma that hasn't been addressed. The symptoms when they're about to have a manic episode, you're going to see someone in an emotional meltdown that's very internal. So they're going to stop being present. They're going to be focusing inward. They're going to be very distressed, and they're probably not going to find it easy to make eye contact with you. They will be very focused on their anxiety and on their symptoms. They will most likely have suicidal thoughts because of how overwhelmed they are and how much their nervous system has gone into overdrive. And they will be restless. They'll find it hard to sit still, and they will essentially have sped up on the inside. So they're having a manic episode, but it's all internal. They are speeding up on the inside. They cannot control what's going on. They're completely overwhelmed. They are focused inward, and they are not able to carry on with life. There may be suicidal attempts during this episode because most people who are having a manic episode internally are going to be suicidal. This is a very dangerous situation for someone to be in. So just because they're not impulsive does not mean that they won't make an attempt to end their life. And if you want to hear more about this condition, I will make other videos on how you can help someone come out of an inwardly manic episode.